Hey guys, Dr. Kristie Ennis. One of the big secrets of keeping those hips pain-free is getting them as strong as possible. So today we are going over all the exercises you need to hit all of those muscles to keep you as pain-free as possible and even help some pain if you're in it already. Exercise number 1 is going to be on the ground. You can always do this in bed if it's not comfortable to be on the ground. Lying all the way on that hip, trying not to roll back, lifting away from the mat or the bed a little bit with your torso. And when you look down at your legs, oops, mine are a little far back. Got to shift forward there a little. You should see your toes, your feet. You can wag them around a little bit. If you see a lot of your leg, you're too far forward and you're going to start using the front of the hip, which is what we're not working on. We're working on the side of the hip today. So from here, you can take this top hand and place it on your hip or place it on the ground. This top leg is going to scooch back just a touch so that I'm tapping my heel. I'm going to lift up, and then if it feels okay on your hip, you are going to point that toe down. Again, really just to isolate all these muscles in through that side of that hip. That's what we're working here. For this one, I tell people that it can vary. Usually it's around 15 or 20, but the key for this is that you want to make sure that you're feeling a little fatigue, not pain, but fatigue in these muscles up here. So that may be more, it may be less. You listen to your body and make sure that you do both sides. This next one is going to work all the hip rotators of the hip. So starting out in almost a clamshell position with those knees bent in a straight line again, you're going to lift that top leg up, this time the foot as well. And from here, without trying to shift around that leg, this is the tough part, you're going to lift that knee a little bit higher, come back to the center, and then you're going to dip that knee. So internal rotators, back to the middle, external rotator. So notice it's a pretty small motion so that you're not doing this and moving your body in funky ways, but you will totally feel this one. Typically about 10 for each direction, but again, pay attention to your body and how it feels. And again, both sides. For this next one, I keep one knee bent up so that I can help protect my back. You can do whatever's comfortable for you. We're going to start with those toes pointing straight up. You're going to squeeze that quad muscle by pressing that kneecap down into the ground. You want to hold that this entire exercise. Like I said, we'll start with those toes straight, making sure I engage those abs so you don't arch your back. And we're going to lift that leg. I'm not lifting super high, but now I'm using those hip flexor muscles. So you can do about roughly 5 in each position here. So that's the first position. Second position, you're going to rotate that foot out. So still working those hip flexors, but getting a bit of a different angle, right? We've got a bunch of muscles down there. And then obviously the third one is going to be rotating that foot in a little bit, which is clearly the hardest for me, and both sides. Next 3, standing, and this first one uses this whole back of the leg, even the calf muscles, so you're getting bonus muscles here today. So you're going to stand on one leg, and the leg that's on the ground is going to be the leg that's doing the work. So I'm going to pick this other leg up. If you need to, you can hang on to something for balance. Totally fine to do that. We want to focus on the muscles that are working here. A little bend in that front knee, both hips pointed straight down. Sometimes you have to turn your toe in a little bit. And then you're shifting, or whoopsies, you see, need a little balance, pushing those hips straight back. That's why this leg isn't lifting to do the work. It's this leg on the ground. So like that drinking bird, if you're of the right age group like I am, you'll know exactly what that is. But it's that hinge and come up. So I'm keeping my back nice and flat as I do this. This is great too because you actually get a little bit of lengthening even in through the hamstring. I'll just show you the other leg so you can see that too. Same idea, press back, and if you need to, go ahead and look at your foot once just to see what it's doing, and then try to keep your head forward. So again, for this one, usually about 10 to 15, but go again until you feel a little fatigue. I like to use a band for this next one, but you can definitely do it without. However, you do need a wall or something sturdy to lean against. So back is going to go flat. You're going to walk those feet pretty far out, and you're going to slide on down. As you get to the bottom, wherever that's comfortable for you, you're going to pull that band apart, and then you're going to slide, hopefully, on back up. So make sure you're not sliding down too far so that you can make sure you can get back up again. So this is working the front of the legs, the side of the hips, a lot just by going down, and then adding that band even makes that more. So make sure you do as many as you can to get all of those muscles feeling fatigued. They might, after doing those other ones, be feeling a little bit more fatigued than you did in the beginning. So you might want to do a few less reps of this one.